I'm going to tell you like a bunch of things about myself, which is that I had a lot of trauma as a child. So there's something called ACEs, an ACEs score. So it's the Adverse Childhood Experiences score. So if you're somebody who's there's a bunch of things that contribute to this, but it's basically that there was a massive study that was done in the early 2000s by Kaiser, the Kaiser Health System. They looked at thousands of people and asked a bunch of questions about sort of adversities that people had faced as children and how did they see the health impacts of those things into adulthood. And the reality is that there's a huge connection to the kinds of stresses that we experience as children and the kinds of health outcomes that those can be tied to as adults. This has launched a whole bunch of other research in sort of the trauma literature about what what are things that can be protective factors from that? Like, what are positive experiences that we can have as children and as adults that can help to support us?